Right. So I'm Dr. Veerle van Zicht, and my mission is to teach other healthcare professionals how not to get burnout and how to bounce back out of burnout, because I don't want other people to go through the hardship I've been through. And I'm very keen to talk to Sonia because as a dentist, and you're a very specialized dentist, right? Can you explain exactly what you do?
Yeah, so I'm an endodontist, so that means I'm a root canal specialist, and that's all I do. I do root canals about 8 times a day.
Wow.
Yeah. So I like to call myself a tooth saver, plain and simple.
Yeah. That's amazing, like the tooth fairy. We all need you. So that is very similar to when I was a super specialist as a vitreoretinal surgeon. I also used to do 8 to 10 retinas a day. At the moment, I'm more like working as a general ophthalmologist because they don't have the equipment when I'm working to do super specialist things. But I understand your passion to be like really, really good at some little thing, and you're also teaching other people who do it really well. Isn't that what you're doing?
Correct. Yeah. So, yep, I am basically, after 10 years of being an endodontist, I realized that I could really share my my growth through my mistakes with other people so that they didn't have to make the same mistakes, and I can just make them more efficient and just better at doing root canals, because there really is a need in dentistry to learn it a little bit better, because we just don't have enough time in dental school to really get through all of that and to really focus on it. And if you think about it, endodontics is really the basis of dentistry, because about 80% of our patients come and see us when they're in pain. And so you need to be able to diagnose tooth pain, and that's what our specialty is all about. So yeah, I think it's really, the course is going to help people, help the patient indirectly, because people are going to really understand endodontics so much better after going through that whole course and the process.
That's super cool. When you were talking about that, I just had like a lot of flashbacks of my own experience with dentists, and I mean, a lot has changed and improved since I was a child who I didn't brush my teeth properly. So I had lots of dentist visits early on in life, and my first experience was horrible. But then I found like a really more progressive dentist who put me at ease. And it's important how you approach every individual, because obviously dealing with anxious children is different of dealing with very aware adults and elderly people. So that's why I love treating every case. I mean, I know you have a program on how to do this all better, but still, does it work? I'm sure it doesn't work the same like for a 6-year-old as it does for a 66-year-old. Because my daughter broke her front tooth and she's only 9, and it takes a lot more efforts to save her tooth than it did for me. I also cracked my tooth when I was in my 20s, and I had this most wonderful experience. I lived in Paris at the stage, and my neighbor was a dentistry student, and took me to a professor the same day, and he spoke to me as if he was hypnotizing me. And he did my whole root canal thing without having any bad experience. In comparison to my first experience was like getting smacked by somebody and like hold her down. And it was like very traumatic, my first experience. And 20 years later, it was a good experience. So, and I see now in my children that they are a lot more relaxed in the dental chair, because I think a lot of evolvement has been done to how to make people experience less pain and feel more relaxed, so that it becomes easier for the patient as well as for the dentist to do a proper procedure. So it's positive evolution for sure that I see. So well done.
Yeah. I mean, the theory is the same for the tooth, right? But there's so much that goes into your communication with the patient. And when you spend that time with patient education and then patient communication, making sure that your patient is on the same page, is really, I think, a huge part of the process of reducing the anxiety of the procedure. When you know your patient understands it and really you can walk them through the whole step, they know what to expect, and you're managing their expectations all the way through, you really have a less anxious patient. And so the idea behind the course,
I can't hear you anymore, so I need some better internet. I'm just gonna talk to my kids again for getting some better internet. 1 second. Are you all offline? Because I can't hear what you're saying.
hear me now? Is that better?
Anna, are you offline? Please. Okay, let's see whether I can hear you now. The image looks better.
Did you hear any of that?
No, can you repeat that again, please, about your program?
Sure. So I was saying that, can you hear me okay?
Yeah.
Yeah, okay. So what I was saying is really the theory behind everything is the same, you know, when it is the tooth, but the idea is to really understand the information so well that you really have a good understanding, and then you can be eloquent, and then it doesn't matter if you have a 6-year-old or a 66-year-old in front of you. You just change a little bit the language so that, you know, you're talking to that individual in front of you. However, I spend so much time on patient education and really communicating with my patient. So I manage their expectations. And when I do that, it decreases their anxiety completely.
Yeah.
So I spend a lot of time on that in my practice, and it's what I encourage and teach in the course as well.
That's great. I know for any patient in any position, to understand what's happening and what they're feeling is normal or abnormal, and being talked through the process. Well, for most patients like me who likes to have a little bit of, I like to know what's going on. It's really useful for people to like accept and relax. This is all going well, blah, blah, blah. But I mean, there's still the old-fashioned patients sometimes that say to me like, I'm so anxious, just don't talk to me. I don't want to know anything. Like when I'm doing surgery on their eyes.
Right. Just do it. Yeah.
And then I just tell them like, oh, it was a nice time. You had you know, whether it was a nice time, you went for a nice holiday, and just think about that then. And then I'm just quiet and let them like be in their own space and just hurry up with my procedure. But yeah, most patients like to know what's going on, and it helps them to really have that trust relationship. That is great. That is great progress, because it didn't happen 40 years ago like that, in my experience.
Right.
Yeah. And what else do you teach your students? So communication, the right technique.
I mean, that's pretty much it, but it's like, it's the whole gamut, everything that you were supposed to learn in dental school, essentially. You know, because it's really important, I think, to go back, and once you have some clinical experience, to go back and kind of relearn everything all over again. Because it'll just have a different meaning to you and a different point in your life after you've kind of made some mistakes and just had a little bit more of that experience in the real world, and you know, doing clinical dentistry.
That is so true. I mean, I can't believe I wrote like my specialist exams probably like 20 years ago, and every day I'm still like thinking like, whoa, I'm learning this and this. I didn't know that 20 years ago. So constantly learning new things is new, as a professional. Excellent. So can we shift gears a little bit and talk about burnout in dentists, because that's my passion, to help professionals, especially medical professionals, help avoid burnout and how to bounce back out of burnout. And I know it's a lot more common in people who care for other people, so medical staff, dentists, also people who work night shifts and things like that, carers in general. So do you have any experience with that? Have you noticed that in your colleagues sometimes?
Yeah, actually, well, I'm in a few like really close Facebook groups, and it's just a bunch of dentists. I'm in one, which is a mommy dentist and business group, and we are very vulnerable with each other. We're very intimate, and we kind of spill all our beans to each other. And there's always a common theme, and a lot of us are like, hey, has anybody thought of, just selling their practice because they're done with it? And that topic comes up quite a bit because it's so much, especially for women. I think it's a little bit more because I don't know what it is in us, but we just try to do our best no matter what. And then a lot of us are mothers, but running a practice and finding that balance can be really, really hard. I know that burnout 3 years ago, no, end of 2015, 2016, I was in the thick of it. I was probably at my lowest of lows. And it was really sad for me because I knew that I had so much more in me to do. I knew I wasn't done, and I knew even my practice wasn't the last thing that I was going to do, but I was exhausted. I had so much turnover with my team, and I felt like patients weren't being happy either, and that sucks the energy out of us too, because we get so hurt if they leave like a bad online review or they're just not fully happy because we're putting in our all. And it's easy for us to really take that to heart, to let it affect our sleep, to take it with us for a few days. But burnout is definitely there. And if I didn't wake up in 2016, I probably would have sold my practice. But I started to wake up, and I did of a role I was playing in my own story. Yeah, but it's everywhere. My story is not the only one.
No.
Go ahead, sorry.
But I agree with you. I think it's a lot more common in professional women who have children, because you might be a very ambitious person up and put yourself and your career first, but then when you have your first child or you start a family, or even you get married and you have a partner that suddenly starts to expect things from you, then you think like, whoa, how can I deal with all of these different jobs that I have to do when you're like so focused on your career or being very successful in professionally. And that's the second time I burnout is with the birth of my first son, because I wanted to be still a perfect surgeon, still a perfect wife, still have a perfect home, and also be a perfect mom. And there's just not enough time or energy to be perfect at everything. So that was my realization, and that really was a hard lesson for me. And I broke down because of many physical complications of the birth also. And I ended up in a wheelchair for about a year, but I still continued working. But then, I think this is a very important moment in people's life when you identify a lot with what you do professionally, and then suddenly you get this other role, and then you realize like, oh, I can't be perfect at everything at the same time. It's too much for one person. And one of the realizations I had early on, actually, my obstetrician gave me some good advice early on, because she knew this could happen to people like me. She said, like, from the beginning, have at least one date night a week, because otherwise, I mean, she didn't say why, but it was wise advice. Even with a little baby, we could go away 1 or 2 hours just as a couple, so that you don't really lose or ruin that relationship. Very important. And I see a lot of young parents who don't do that. They say like, oh no, I'm not leaving my baby alone, blah, blah, blah. So yeah, we did that. That was good. But also, and she even sent her own daughter to be our babysitter. And I realized when I was trying to keep the whole place spotless, And I think that I once had like a professional cleaner in or something, and I thought like, wow, this woman is so much better at it than me. And then I thought like, why am I even bothering spending 10 hours of my time doing what she can do in 1 hour? Because clearly that's her talent and not my talent. So I also realized sometimes you have to
Right.
give jobs away to other people who are better at things and stick with what
Yeah.
you're good at. And yeah, the
Yeah.
delegation thing was a big thing that I had to learn how to do. And ask for help was a big thing I had to learn how to do. Like, no, I cannot lift all of these heavy suitcases when I have health responsibility. So yeah, there's a lot of changes that happen when you become a mother, and it just, I think emotionally and spiritually is like a very big process of change in a good way, because after always having been the main person in your life, suddenly there's another person who becomes the main subject in your life. So it's a big, big, big changeover. And if you still want to keep on working at the same time, it's a lot of things going on at the same time. So I really want to reach out to fresh parents, young parents who also might not get enough sleep, not enough time to regenerate. When you don't sleep enough and you're tired, you might start fighting with your partner. You might feel like you're not good enough because you're not perfect at everything like you used to be. So I want to really reach out to these people and say, like, you're not alone. It's okay. It's a part of life. Focus on
Right.
the positive growth you're going through, because you're letting go a lot of the ego stuff and really focusing on what is really good for your soul, which is like a good relationship, having a really nice bond with your child. You need to prioritize other things in your life than just being a professional, a successful professional.
Right.
And a lot of people have
I agree.
identified so much with, I had this as a crisis, like, but I am a doctor, and I was so identified with what I did that I didn't even realize, who am I if I'm not doing that anymore? And I think that's a big identity crisis that often happens, and it's hard to go through that if you're so attached to your achievement and you can't achieve anymore. Then you think like, wow, am I still worthy of living because I'm not doing anything useful anymore? Which is not true, but it's what people think for a while. So I really want to reach out to people who are going through that process, because I really, really love empowering people and helping people through these transitional um, times in their life, where I really like to like pump up people and show them the positive side of them that I see potential in everybody. But often people don't see it in themselves, and they don't have enough self-love, and they're just like beating themselves up for not being perfect and not being Superwoman and Wonder Woman, and having the perfect size and flat tummy and all of that. No, sometimes the six pack goes out of the picture, unfortunately. I also, um, so yeah, that is what I'm really, really enthusiastic about. And there's a lot of guys also out there who go through a similar thing when they have their first child, because they also have to like, everything has to reshuffle in their relationship, in their work life, in their sleep, in their priorities. So, do you think that would be useful for some of the people that you know?
Absolutely. I mean, I think you made a really great point on just asking, not even asking for help, but receiving help, like being open to that.
Mm,
So many people just don't, and they need to work through that, and they just need like some time to just have like that clarity where they can even write down what they want for themselves, because so many people don't know, and I think that adds to that burnout. But
mm,
they're just running here with the family, and then after school things, and then going back to their practice, and just forgetting about themselves, and making sure that letting them know that it's okay to take that time to work on
yeah,
you. And it really
yeah,
wasn't until I started to work on me that I started to feel better.
mm,
And I think that's a great message. And I think more and more women, I mean, I know you say men too, but sorry, I just identify with the women so much.
yeah,
But I see a lot of my friends, even and colleagues, that they don't give themselves that night off a week, and they really should.
Yeah,
So
absolutely.
I think you made a really great point.
Mm. Thank you for that. And it's not only like the date night, it's also like prioritizing time to recharge. Because people who
Hmm.
are in the medical field, like you and I, usually it's giving energy and attention to other people. At the workplace, it's not really about receiving, and also if you have staff that you take care of.
Hmm.
So then you go home and you like giving to your partner, hopefully receiving a bit, then you're giving to your children. So you really have to prioritize a moment in every week that you say, like, I'm doing something for me, something that will give me energy, because otherwise you're like a car running on empty. And if you don't have any petrol anymore in your car, it will just stop, and your family won't work anymore, your business won't work anymore, you won't
Right.
go anywhere anymore. So it's very, very important that you prioritize that. And I feel like a lot of women have a
Hmm.
problem with that because they feel it's selfish and they're always like so used to sacrificing
Right.
themselves and putting other people first. But that is a big wake up call I would like to give women. Like, if you don't take care of yourself, there's nobody else who can, well, that's a big statement, but who will take care of all the other aspects in your life? So I always
But you're
give that.
right. We have to make ourselves first priority. You're totally right.
Yeah,
It's
yeah.
so important.
And like sometimes people ask me, what's happening in your life, and I say like I'm just going through a selfish phase because I'm doing
Yeah.
what brings joy to me, what feels good to me. I'm doing the things that I want to do, and I am now old enough to say like, and I don't feel guilty about it. But it was hard originally because we're not brought up that way. Most of us, feel guilty when. I mean, it's a personality trait, I guess, where you think, and maybe it's more common in women, where you think like you always have to take care of others. It comes natural to women, doesn't it?
Hmm.
And yeah, so you really have to, it's a tough one, I find, to say like, it's fine if I put myself first. It's fine if I put the oxygen mask on myself first so I can help other people around me. That's what we
Right.
need to do. Yeah.
And I think it's important to schedule it. Like if you don't schedule it, it almost doesn't happen. So
Yeah.
I tried to like carve out, okay, Friday mornings, I'm not with patients. I'm not with my family because my kids are at school. And that's kind of like my time. If I need to go get a massage, like that's when I do it. If I need to get my nails done, that's when I do it. If I want to go have coffee with a girlfriend, that's when I do it. So I schedule that into my
Mhm.
life just to make sure that I have like half a day just to me, you know?
Exactly, that's what everybody needs to do. And I think most people will
Yeah.
understand. I mean, I know my children understand when I say, I mean, I usually do it on a Saturday morning and say, like, hey, I'm off for a massage or something. And are you fine? And they say, like, yeah, they don't have any problems with that. But I think some people, if you're in an environment where they don't really accept where you take care of yourself, I've been in that in the past. And it's really hard because I remember going to the gym after work because this was my stress release. Because as carers and
Hmm.
medical people, you sometimes take home a lot or take on a lot of the anxiety and unhealthy energy of the people that you deal with the whole day. I mean, I'm very sensitive to that, so I would
Right.
carry all of these emotions of my patients with me. And my solution was if I just go and exercise, I can kind of shake it off and,
Right.
then I can go home like feeling like myself again and with a better vibration and energy. And that worked for me
Hmm.
really well. But my husband said, like, I don't see you enough. I can't understand why you prioritize exercise over me. And that's when I went downhill for a while because he said, let's rather have a bottle of wine together. So you see that I made a healthy choice of stress release and physical exercise. And I had to give it up for go home and drink a bottle of wine every night. was not a wise decision. So I hope that all of the partners can support their wives. And like, yes, you need that time for yourself so you can stay healthy,
Right.
so you can have that stress release. And you know, it's
Mm-hmm.
important that partners also are on the same page. I think children are usually fine, saying like, we just want a happy mommy, so whatever you need to do is fine with me. That's what I see. Yeah, that
I
is
know
it.
I have trouble on like doing anything like that on Saturday or Sunday because I come with a lot of mommy guilt. You know, when I'm working Monday through Friday,
Mm,
I need to see my kids on Saturday, Sunday. So I I wonder if a lot of moms feel that way too. Like, oh, I can't go to the gym because I just spent all this time at the office. Now I should be with my kids. And what I
mm,
learned is that it was just easiest to work out at 5 in the morning because
yeah,
everybody was still sleeping, including my husband, and
yeah,
nobody could like change my mind. It was
mm,
just me. I was up and I actually loved it. I loved like waking up and not having anyone disturb
yeah.
me. And it was so peaceful to get to the gym. Um, but I know that mommy guilt probably plays a big role in that too,
It does. It does.
especially if you're working Monday through Friday.
And it depends on the age of your children, because if they're really small, yes, you want to
Sure.
be the whole time. But I mean,
Yeah.
my children are 9, 12, and 15 at the moment, and they just like their own time, and they just like to do whatever they like doing, and they take care of each other. I often ask them, like, do you want to come with me? Do you want to do something together? And they say, like, no, we just want to chill at home. I said, okay,
Yeah.
I don't
Yeah.
have any bills
My
anymore.
kids are Yeah, mine are 9, 6.5, and 3. So I'm still in the thick of it, and I still
Yeah,
have tremendous mommy guilt. Yeah,
yeah,
so
I
when
understand.
soon they won't want to hang out with me. So
Yeah, yeah, that's happening. So my 9-year-old said, like, when are we going for our next holiday? I said, okay, I'm working on it.
Oh,
So yeah, it's true. It changes as they grow older and they just want to do their own things. But
I
I did
know.
experience a lot of mommy guilt when they were younger, especially with my first child. I just, I had to go back to work like after 3 weeks, and I felt so bad of not spending time with my
Mm.
child. And so luckily I got the burnout, and then I stopped working for a while. While I was getting out of burnout, I had some really good bonding experience with my firstborn. So I think I've healed that.
Oh, it's amazing.
Yeah, so luckily, even though I was ignoring the signs and symptoms for a whole year and fighting it, and I won't give up and I will stay perfect at everything, when I finally broke down and took time off, then I could really find myself. But hopefully,
Right.
other people don't have to go to these extremes. I like to teach people, as you can see at the back, like how to boost their energy in natural ways, how to manage their time better so they can do the things that are
Hmm.
important to them every day. And I mean, hopefully they will be living their life purpose already. If not, I just have very cool journeys to find that. And I love
But
emotional.
your list is perfect.
Yeah.
Your list is perfect because once you manage your time and you have that time to like get that clarity, you
Mm,
find your purpose. So like eSchool is actually a product of my burnout
mm.
because I
Yeah.
really I knew I wanted to do something else, but I didn't know what it was. But the moment I stopped working 5 days a week and went down to 3 days, and had time for my work, I had time for my family, I had time for myself, and I had time to reflect and like really figure out what I want, then that's where the idea of eSchool came. Like I'm like I have a bigger purpose in this life, and
Mm,
it's really to help people save money when they go to the dentist. So
yeah.
what your list behind you is like it's spot on. And
Mm,
then again, when you find your purpose, you also get that energy boost again, and you want to like wake up in the morning again. So
yes.
I think there's some beauty in burnout. um, but
Yes. Unfortunately, yeah.
if you can really
Mm,
find it,
mm,
it can be beautiful. Because if I didn't get have that process of burnout, I probably wouldn't be exploring beyond what I was doing.
Yes, and
But
that's the other thing that I would like people to know is if something really bad happens to you, I mean, you think that this was really bad experience for me, but always try and see what is the positive that comes with it. Because, I mean, it's not only about secondary gains, it's about like, okay, this is a drama in my life, but what good is coming from this? And that's what you just said, is it helped you to have time to create something bigger and more on purpose. And I think that's why these things happen to us when we're not on the right path.
yeah,
Some catastrophe will hit us to just like boom, okay, you need to start again. Okay, what is my purpose? And go for that. So it's true. I mean,
yeah,
it's really, really tough though when you're in the darkness alone and you don't know how to get out and you're in this terrible place. And that's why I'm reaching out like to people who want a coach who's been through it. I love to lift people up and make this process go a lot smoother and faster so they can sail to their true purpose faster.
If only I knew of you a few years ago. My process could have been
I knew
a
about
lot.
me 10 years ago.
Yeah, right? Yeah.
Find a solution. Yeah.
But I mean, it's great that there is like support like this, and more people need to know about it, because you can get better. You can love yourself more. It's not even just life purpose. It's also loving yourself more and forgiving yourself for certain things and realizing that you can change, and all that beauty that self-awareness brings for you. I mean, that's really what it did for me. Changed my whole life. My whole trajectory changed by giving myself time and, really just writing things down and seeing what I really wanted. But I think it would have been a lot faster if I had somebody like you to support me through the process, especially since you've been through it yourself,
Yes, I think, I mean, if people are just on the edge of burnout and they just like get my like 6-module program, I think they can go back on track in 6 weeks. I think you can do that.
Yeah.
Like very early on, and otherwise, it might take longer depending how low you are and how much you need to change and reshuffle your life. But ideally, people should like have this realization something is wrong and I need help earlier on, so they don't have to like go the long way, but they can go, the highway.
Yeah, exactly.
Yeah. So my program is available at burnoutexpert.co.uk. And if people want to contact you for your program, eSchool, I love the name, by the way, how can they find?
Thank you. Sorry, you went out.
How can people contact you for your eSchool or any other questions?
Sure. Well, I am on Instagram at Sonia Chopra DDS. That's Sonia with an I. So my first and last name, and then D as in dog, D as in dog, S as in Sam, DDS for dentistry. Okay.
Yeah.
And then my website is soniachopradds.com. And that's where they can find information about a little bit more about my story, and then also eSchool if they want to sign up. And then on Facebook, I'm Sonia Chopra DDS Endo for All.
Wow, cool. So there's a lot of places people can find you. So I want to say thank you so much for spending time with me to discuss this issue that a lot of professional women have to deal with. And you made it through, and you came out really amazingly with eSchool. And I think I changed a lot also through my experience, but I wish there were more people out there to help me at that stage. But still, the more we talk about it, the more people become aware that there's help out there. And if anybody wants to contact me with any questions, you can do so through my website. I'm also on Facebook as Burnout Expert. So yeah, thank you so much for spending time with me, and I will send the recording to you and make sure that your website and everything is if you're okay with it, I can mention that under the
Yeah,
video and everything. Is that good?
that would be great. Thank you so much. I really appreciate it. It was great chatting.
Thank you, and I'm so glad that we got to speak, and all the best with your new life purpose. And you look like you're
Thank
doing
you.
great. Very happy for you.
Thank you. And good luck to you too. And hopefully we can connect each other more with other people and make it a bigger, a better world.
Absolutely. Yes, let's do that.
Awesome.